with your patients
Sure.
here?
Look, why are we testing? We're testing because either somebody has a complaint, they've looked for medical help but they couldn't get answers. We call that dysfunction, because when you have disease, a doctor can pick it up. I'm a doctor, so there's different tests for dysfunction, for disease, but you can't use the same test and expect to find dysfunction. So let me give you examples. So when you have high blood pressure, you have a disease, they give you a medicine. But what if your blood pressure is on the way up, but it's not high enough to give you medicine? That's called dysfunction.
Yes.
But for us, what we try to say is that why is the blood pressure going up? So that's a really easy one to do. So let's see if people can understand it. When you're sleeping, your blood pressure is low because you're resting and there is no demand from the muscles. There's more demand from the brain, so that's why it increases.
Yes.
So at night, your blood pressure is low. So what happens to your blood pressure when you're running? If you're running and you measure your blood pressure, which I did, in my 30s I measured my blood pressure. On the treadmill when I'm running fast, it's 210 over 130. That doesn't mean I have hypertension.
Yes.
So the blood vessels are responding to the need. So when the muscle is demanding blood, then the pressure pushes the blood to the muscles. That's how you perform. So really, blood pressure is not a disease by itself. It's your body's responding to something. So when doctors just look at the number, and when it's elevated, they want to treat the number by just blocking an ACE enzyme, angiotensin converting enzyme, or calcium channel blocker, they're not answering the question, why is the blood pressure going up? So the point is that when you have inflammation, your blood vessels are responding to the inflammation, your blood pressure goes up. When you have oxidation, your blood vessels are responding, your blood pressure goes up. When you have immunological problems around your body, like autoimmune disease and disruptions in, say, inflammatory bowel disease or things like that, your blood pressure will go up. And so it's very important to understand what is making the blood pressure go up and addressing that. Because if you can fix the inflammation, you can fix the oxidation, and you can fix the immune problem, you don't need to take a blood pressure pill. And other simple things that create blood pressure is when you have insufficient quantities of minerals and antioxidants. So even the vitamin C can affect your blood pressure. Vitamin D can affect your blood pressure. Magnesium can affect the blood pressure. So the most simple thing to do is when you just measure and then replace the nutrients, you identify what's creating the problem and then remove it, you actually fix the problem. You don't end up being on medicine for the rest of your life.
Yes, that's really interesting. And which tests do you use to measure how is your patient, for example?
Yeah, look, it's so you listen to the patient, and if they say something like, I'm tired in the morning, I'm tired in the afternoon, then I get a little bit of energy, then I'm tired. So we can measure what's called the 4-point cortisol test. You can do it in your urine or saliva. So it depends on what the patient complains of. The trick though is some people don't know they have a heart problem. So did you know that you have to have greater than 90% blockage in your heart for a positive stress test? The stress test is when you go on a treadmill, they put the electrodes on your chest. If you go at a fast pace, and if you have a blockage that's more than 90%, it'll show up on the EKG.
It's a late marker.
It's a very do is identify what are the risks that cause blockages and what are the risks that cause heart attacks. So to keep it simple, inflammation is 70% of the risk for heart attack. Blockages have some overlap, but blockages are more from dense lipoprotein particles.
Yes.
So not the cholesterol, but the LDL, but not the LDL, the dense LDL. Not the dense LDL, because the more smaller the LDL particle or the lipoprotein particle, the more dangerous it is. So lipoprotein A, for now, is the most atherogenic particle, and doctors don't test for it, nor do they have a treatment for it. You have to understand that just like inflammation, just like oxidation, those similar environments allow the expression of lipoprotein(a). That's why prescription doesn't work. You have to change your lifestyle. And for doctors like you and me, we have a little bit more knowledge than just saying lifestyle. We know how to deliver the antioxidants. We know how to deliver the anti-inflammatories. We know how to alter the microbial flora. Just look at where the root of the problem is, and layer by layer, when you fix it, you actually actually not only fix the problem, you make the patient feel better.
Yes, and it's interesting that you said that because sometimes when I take a conventional exams for my patients, it's all normal. But when I look at the, I don't know, functional test, and I said to my patients, you know, your body is acting normal, but it's acting normal working on 100, 200% to give these normal values. So the conventional values are not exact saying how is the patient from the inside, and it's sad, but we learn only to interpret those conventional tests. And as you said, we have to have a 90% block of the artery.
That's right. So you're right. I think that if you want to look at disease, you look at conventional labs. That's what they were designed for. If you want to look at function, you can't use those labs.
Yes.
I interpret a little bit. We can talk about that later. And there are also labs for dysfunction. So when you want to measure your vitamin levels and you pull the blood, you're going to see what's in the blood based on your diet the night before. You're going to see what supplement you're taking because it's in the blood. But we measure the intracellular vitamin level because it takes time for it to go from the blood to the cell on day by day, over week by week and month by month. Then it becomes intracellular. It's a more steady state. So really, it's the type of testing you do to find out the function as opposed to disease. And so it depends on what you're looking for. And then that's the simple stuff. The complicated stuff is trying to understand how the diet alters the microbial flora, which then sends the signal to the cytokines, and then how the liver then releases inflammation. That's a little bit more complicated, but again, it goes back to you have to use the right test to find the solution. So doctors that use conventional medicine is really to diagnose diabetes, lymphoma, leukemia, anemia, exactly. So or inflammation from rheumatoid arthritis would give you a very high sedimentation rate. Other inflammation may give you a elevated C-reactive protein. But if you're looking for microscopic inflammation, you have to look at highly sensitive